Well, good evening. Thanks for joining us tonight. I'm Kate Lauman, social media consultant for SSM Health. Welcome to our Google Hangout on Air. Now, tonight we're talking about weight loss and the different approaches, both surgical and non-surgical, for you to get down to a healthy weight. Now, during this chat, we'd love to hear from you with your questions, and there are a couple different ways that you can send those questions to us. First, you can email those questions. Our email address, askssm@ssmhc.com. Also, you can tweet us those questions. Just use the hashtag AskSSM. Also, post on our Facebook page, YouTube, or Google Plus page. You can just search SSM Health. Now, answering your questions tonight, we have Dr. Andrew Wheeler. Now, Dr. Wheeler is a bariatric surgeon with our SSM Weight Loss Institute at DePaul Health Center in St. Louis. Dr. Wheeler has extensive training in weight loss surgery, and he is going to talk about all the risk, benefits, and everything you need to know about that surgery and non-surgical options tonight. Before we get to your questions, we would like to turn it over to Dr. Wheeler. Dr. Wheeler, thanks for being with us tonight.
Kate, thank you so much. It's good to be here. It's good to come and talk about something that I'm so passionate about, and that is the obesity as a disease. So we'll get right into the presentation right now, where we'll talk about obesity. Obesity is a disease, and it's a disease that affects a lot of people around the world. We know that obesity has become somewhat stereotyped against in this country particularly. And that's unfortunate, because I think it reflects a misunderstanding that patients that suffer with obesity aren't lazy or don't care about their health or don't want to be fit, but simply that it's not that simple. We do know that diet and exercise are key components, and we'll talk about that tonight as components for weight loss. But we'll also talk about some of the options that we offer at the Weight Loss Institute with SSM, and that as well surgical and non-surgical options. We know that obesity is not simple. It's not simple, and that's why it's such a difficult thing to treat. It's not simple because there are many, many factors, many more than are even listed on this slide, that affect a patient's struggle with weight, that lead to obesity, and also to affect the ability to lose weight. We know that there are metabolic impactors on a patient's weight. We probably all know people who can eat whatever they want and still lose weight because their metabolism runs at a different rate than other people. We know that there are hormonal impacts, hormones that circulate through the blood and cause a patient to be more hungry, especially when they try to lose weight. We do know that increased caloric consumption and decreased physical activity not only are key components to weight gain, but also by affecting these are important components to weight loss. And finally, there are genetic components. No matter what you do, some patients have a genetic makeup that prevents them from losing weight as well. Obesity, talking about obesity is important, not just because it helps patients feel better, it helps patients be more active, do more things that they want to do, but because there are significant medical complications of obesity. Obesity affects every organ system of the body. It affects the lungs, it affects the brain, it affects the heart, causing heart attacks. And then even now, we know that there are increased links of cancer being impacted by obesity as a risk factor. However, weight loss is not easy. We know that significant long-term weight loss is not successful for many patients, even though the benefits of weight loss are drastic on the body. Because it's not easy, we know that aggressive intervention is required for long-term success. We know that diet and exercise are still a foundation. However, additional tools to help control caloric intake are often necessary. Ultimately, it comes down to fewer calories in than fewer calories burned. Unfortunately, because of the hormonal and metabolic influences, the body often fights this. As we decrease calories to help lose weight, the body attempts to resist that through affecting the release of hormones, affecting the body's metabolism, affecting the drive to eat more. Ultimately, it comes down to a combination of both diet changes, lifestyle changes, as well as focused exercises. But we know that for sustainable weight loss, significant changes are required. They're required, however, the body fights this, as I said. And because of this, we know that other options, besides exercise alone or changing certain foods that you eat, are often necessary. Ultimately, significant caloric restriction plus ongoing exercise is necessary, but is oftentimes difficult for long-term sustainable weight loss. When we talk about weight loss, when we talk about obesity as a disease, it's important to talk about what a person's BMI is. The BMI is simply a marker or a number that reflects what your height and weight are together. It reflects what your weight is based on your height. And it's a way that provides standardization to talk about these different treatment options. When we talk about the categories of obesity, we do this in order to talk about obesity as it causes or leads to the increased risk of diseases. We know that as a patient's BMI goes up, that the risk of diseases go up. And it's in these last two categories in particular that the risk of diseases goes up most significantly. As we move on and talk about the treatment, the NIH, the National Institutes of Health, has produced a very nice treatment based on your BMI category. We know that in the lower BMI categories that diet, exercise, and behavioral therapy are important and necessary. And as the BMI increases, especially as it becomes associated with comorbidities, which are things like diabetes and high blood pressure, those medical illnesses that are associated with obesity, we know that additional things such as medications as well as surgery in the higher BMI category patients are necessary for long-term control of obesity. When we talk about weight loss options, I like to look at it in three categories. There's dietary and lifestyle intervention programs, and these are more than just cutting back what you eat and exercising more. These are actually intensive programs to help approach weight loss from a multidisciplinary approach. We also offer medications, which can provide some additional benefit in helping control patients' hunger and cravings. And finally, the most effective therapy for weight loss or obesity treatment is surgery. Surgery offers the highest weight loss. As much as 20 to 30% of a patient's weight can be lost after surgery. However, there are more risks associated with surgery, and we'll talk about those a little bit later. In order to have a successful weight loss program, a medical weight loss program, first of all, it should be supervised. It should be supervised to provide some expertise in helping you as you look at what possible options there are, as you have interventions into your weight, and then finally to assess how effective it is. It should be multidisciplinary because we know that obesity is a complex disease, needs multiple professionals involved. Exercise, again, is a foundation, and medications can often be used in certain individuals to help on that weight loss process. Meal replacements are often utilized by myself because I know that that's an effective way to eliminate calories in a person's daily diet. Medications have been around for quite a while. They've gained increased popularity in the last couple of years with now 3 new medications approved by the FDA, but they have varying levels of effectiveness. When talking about medications, my rule is if it sounds too good to be true with medications, then it probably is. There is no magical cure for obesity. It does require hard work, but it's not without hope because we do have effective therapy. No medication is without its side effect. There is no pill that you can take with no side effects, no potential for side effects, and lose lots of weight. And so we fit the drugs to the individual patient. Oftentimes, however, insurance coverage is an issue, and these are things that we can talk about. Back to surgical therapy, we know that it's the most effective. It's the most effective for long-term therapy, but it's not without risk. The 3 procedures that I offer include the gastric bypass, the sleeve gastrectomy, and the adjustable gastric band. And patients who qualify for these would be patients who have a BMI of more than 40, or if you have a BMI of 35 to 40 with a significant comorbidity. When we talk about weight loss, the different weight loss options, it's important to understand how we do these options. If you can go on to the next slide. For the last 20 years, we've been doing weight loss surgery in increasing percentages in a laparoscopic approach. Prior to this, weight loss surgery was done through a large incision in the middle of the abdomen with a lot of morbidity or complications associated with it. Things such as wound hernias, wound complications, prolonged hospitalization, increased pain, all came with open weight loss surgery. With laparoscopic surgery, especially as it's becoming increasingly safe, we know that patients spend less time in the hospital, have less pain, are back to work sooner, and overall have fewer complications. The 3 types of operations are either restrictive, restrictive with hormonal changes, such as the sleeve gastrectomy, and then finally, a hybrid of restriction and malabsorption, which is the gastric bypass. The adjustable gastric band is a restrictive operation. It's a very effective tool, offering as much as 50% average weight loss in patients. In other words, in a person who's 100 pounds overweight, this would be about 50 pounds of weight loss. Oftentimes, it's outpatient surgery. It's the safest operation that we offer. It's the quickest back to work, but it does require monthly follow-up, at least for the first year, to achieve significant weight loss. The next procedure I want to talk about is the sleeve gastrectomy. The sleeve gastrectomy is the newest procedure, and it has become the most commonly performed procedure in the United States. It offers both restriction with hormonal changes, and we know that early on, as much as 60 to 65% of a person's excess weight can be lost with a sleeve gastrectomy, or in a person who's 100 pounds overweight, 60 to 65 pounds of weight loss. In some patients, it may worsen acid reflux, which is always something to consider when looking at this procedure. It's a little bit more involved than the gastric band, and so the hospitalization is usually a little bit longer, but can be as few as one night in the hospital. We see you weekly, or at a week, a month, 6 months, and yearly in follow-up to help you not just learn to eat differently with the sleeve and to incorporate exercise, but help you for long-term weight loss with the sleeve gastrectomy. The gastric bypass was first done in 1967. It was the first procedure done laparoscopically from a weight loss standpoint, and it combines both restriction as well as malabsorption. It's the most effective procedure that we offer, offering 75% of excess weight loss in the early term. And similar to the sleeve, it's usually 1 to 2 nights in the hospital and 1 to 2 nights off of work. Next slide, please. In talking about weight loss, this slide is the goal is to compare and contrast the different things that we offer here. Again, starting at the top are the lowest risk procedures. As we move down, then the procedure or the things that are offered increase in the potential side effects or complications, but also an increase in the effectiveness of those individual weight loss options. We know that there's not a single procedure that offers the greatest amount of weight loss and improvement of other medical conditions, and also the lowest side effects. And so it's important that as you look at these, that you weigh both what you're how comfortable you are with the individual risk, as well as what your long-term goals are. With that, I'll turn it back over to Kate.
All right, thank you very much. A reminder that if you have questions for Dr. Wheeler, you can tweet us. Just use the hashtag AskSSM. You can also post a question to our Facebook wall, our YouTube page, or our Google Plus page. Just search SSM Health, or email your questions. Our email address that we're using tonight, AskSSM@ssmhc.com. All right, we're already getting questions in. Our first question tonight comes to us from Rob in St. Louis. He wants to know, kind of describe what an initial weight loss consultation with you would be like.
Great, Rob. Thanks for the question. The initial consultation really is very crucial, and so it's a good question to ask. And the reason it's crucial is because it's where you come in and you sit down with me and give me the opportunity to talk to you as an individual patient. There's not any certain procedure that's right for everyone, nor is there any certain procedure that's wrong for everyone. And so the different weight loss options that we have really come down to what fits with you. What is your risk aversion to various things? What is your desired goals in losing weight? And so when you come in on a one-to-one consultation, we'll sit down and we'll talk about what your individual weight goal is, what your other medical conditions are that may put you at increased risk for certain things. Then talk about, in light of your goals, what level of risk are you willing to accept in order to achieve those goals.
Susan from St. Charles asked, do you do band to sleeve revisions? She said she had a band about 8 years ago with not a lot of success.
Yeah, thank you, Susan, for that question. You're probably in the same boat that literally probably thousands of patients in the St. Louis area are in. They've had a previous weight loss procedure, and now they're either struggling with it, have not lost as much weight as they want to, and they want to see if there's anything else they can do. Yes, we do offer, I do convert bands to sleeves. We can have good success with that, but it's not without additional risk compared to a primary sleeve alone, and so it's important that you come in and we can talk about that. We can talk about what the expectations are, what the weight loss, or the relief of medical conditions is when we convert that, and then the potential side effects of that procedure.
A viewer has emailed in asking what are the risks and the benefits for patients considering that sleeve surgery?
Yeah, as I mentioned in the presentation, the sleeve is becoming the most popular procedure. The reason it's the most popular is it's that middle of the road procedure. It's not quite as many side effects as the gastric bypass, but a few more than the band. But yet it's a little more effective than the band, but not quite as effective as the bypass. And because of that, it's very effective. We know that the sleeve gastrectomy, as with all the procedures, have both short-term and long-term potential side effects. With the sleeve, the short-term side effects are things such as blood clots, problems with anesthesia, similar to any major operation, and then as well as a leak or a major bleed. Fortunately, what we know with these early side effects is they've become progressively low in frequency, such that only about 1% of patients will develop a leak after a sleeve. 3% of patients will develop a major bleeding episode after a sleeve. Risks that are really much in line with other major surgical procedures that you'll have. Long-term complications, things such as vitamin deficiencies, obstructions from the sleeve, ulcers are also infrequent. Many that can be treated with non-surgical methods or avoided altogether with appropriate vitamin use.
Cheryl from Grand Rapids, Michigan says there's a supplement called Skinny Fiber that's been advertised a lot lately to help people lose weight. Has anyone heard of real-life success with this supplement, and if so, how does it work?
Yeah, that's a great question because it's something that changes daily. There are new potential options that come on the market all the time. If you read blogs, if you read marketing things that are on various websites, it can become very confusing. I've personally not used or utilized Skinny Fiber in my practice, mainly because I mainly stay with the tried and true method. If we change with every new fad that comes out there, I would constantly be making new recommendations to my patients. We know that at the end of the day, that decreasing the amount that you eat, increasing the amount that you burn, is the tenets of good weight loss. If Skinny Fiber helps a patient lose more weight, then that's how it helps to lose weight. But there are no magical weight loss supplements, drugs, methods out there. They all require hard work, but are oftentimes they're very valuable tools in helping patients with that.
This next question comes from Charlie. He wants to know what you've seen with your patients, some of the benefits of weight loss, how their lives have changed after coming to you.
You know, Charlie, probably the biggest thing that I see is that patients come in and they say, I feel like I've never felt before. I feel like I've not felt in years. I used to have diabetes. I used to take large amounts of insulin a day. But now I no longer have diabetes. Now I no longer am on my diabetic medications. I can play with my kids. I can play with my grandkids. I can do things that I never thought to do. But we know that in addition to improving all these comorbidities, it also improves patients' longevity. There are studies that have been published that show that patients after weight loss surgery have an increased lifespan. In addition to your overall health, you're able to do things and have more social interactions that you haven't had before. Your personal life, patients' personal lives improve, and you're able to be more productive at work because there's less time off for being sick and taking care of those medical illnesses. There's less time of missing work because of not being able to do things you need to do.
Yeah, absolutely. All great points. We talked about some of the complications or the risk with that sleeve surgery. Any other risks or complications that you tell your patients about, in general?
Yeah, not really a risk, but one of the bigger things is just the change that it has on a person's life. So the simple fact that you are eating less now, and therefore it does require ongoing conscientious effort in terms of the things that you eat. As I alluded to, it is a tool. It's not a magical therapy, but it's a very powerful tool. Some of the other things that we associate or that we experience that we know about with the weight loss procedures are such things such as death. You know, we can't talk about weight loss surgery without talking about the risk of death. Fortunately, as opposed to rates that were 10 times higher even a decade ago, have now fallen to 3 to 4 out of 1,000 patients that die after weight loss surgery, and it's usually from a blood clot. Things such as strictures, ulcers, and chronic nausea and vomiting can be experienced, and probably anyone who knows someone or has familiarity with the procedures may know someone who says, I know someone that had chronic nausea and vomiting and just lost too much weight and never did well. Fortunately, now we know that with the 3 procedures that we offer, the ones that are safe, that are well published, that are well researched, we know that a lot of these complications, as you can see on this slide, are very, very rare.
We're getting a lot of questions about what you need to do after weight loss surgery. Let's start with the exercise. Will tweeted us wanting to know, about exercise after the surgery. What do you need to do to maintain a healthy lifestyle?
Yeah, well, that's a good question, and there's a recovery phase after weight loss surgery. Now, it's not a recovery phase that you're in bed for 2 or 3 weeks. Most of my patients, the evening of surgery, are up walking the halls, and their pain's very well controlled. And then they progress to gradually building up, where by 4 to 6 weeks out of surgery, I pretty much turn a patient loose to do whatever. It's a great point, Will, that exercise is a key component because it not only increases muscle mass or metabolic rate, but it also helps suppress hunger. It serves as a key component to complement the weight loss surgery. In addition, it has long-term heart and lung benefits apart from the weight loss itself, and ultimately we know that you diet to lose weight, but you exercise to keep it off, as it prevents weight regain.
A lot of questions coming in about your diet. What changes do you need to make to what you're eating after you've had weight loss surgery?
So the biggest thing that we know about weight loss surgery and the diet afterwards is the type of food that you eat and the amount of food that you eat. I encourage patients and our dietitians. We have a very talented cohort of dietitians that work at the Weight Loss Institute. But we encourage patients to focus on things that are lower in carbohydrates, eliminate sweets, because those are things that don't provide a lot of feeling of satiety or fullness, but a lot of high amounts of calories. And really focus a diet on higher proportion of healthy fat as well as protein, because we know that impacts the body's hormones and provides for longer satiety. And then finally, we continue to utilize meal replacements during the process. The other thing that comes in is portion control, the amount that you eat. After the gastric band, we try and get our patients where they're eating about half a cup to a cup of food at a time. With the sleeve and bypass, oftentimes that's as low as a quarter to a half a cup. And it's because of this very caloric restriction that patients do so well. In that, I always encourage food journaling, whether that's from surgery, whether you're doing medical weight loss. Food journaling is a key component because it helps keep us honest and really know how much we're eating.
Those are all great points. Thank you. A reminder to everyone listening and watching out there, if you have a question that you want answered, you can email us that question. Our email address that we're using for tonight's webinar, askssm@ssmhc.com. You can also tweet us questions. Just use the hashtag AskSSM. Also, you can post a question to our Facebook wall, our YouTube page, or Google Plus page. Another question coming in, what are the best surgical and non-surgical weight loss options? Obviously something that you've touched on, but how do you answer that question for a patient coming to you?
Well, yeah, that's a tough question, and the reason it's a tough question is because, like I said, there is no best option. It really comes down to an individual person's perspective on the procedures, the risks that are associated with those, and when you come to see me, we'll sit down, we'll talk extensively about that. It comes down to how quickly you want to lose weight, and also how much long-term success you want to have, and what the different procedures, different medical options offer in terms of their long-term durability. And these are all things that we'll sit down and talk about in depth once I have a chance to visit with you, to understand those individual concerns that you have, and then also assess you from a medical standpoint.
Another viewer wants to know what kind of support is available after having this weight loss surgery.
One of probably the most important questions you can ask, and that is, what is the care after I have my weight loss surgery? If you look at a program, or you look at a clinic, or you look at going to a place, whether it's for medical weight loss or surgical weight loss, and it's a one and done phenomenon, meaning that you go in, you have your surgery, and you go on about your day and thinking that everything is good, I would find that there's a very high chance that you would not succeed with that. And the reason is because we know that just as the treatment of obesity is a lifelong journey, we know that the treatment of obesity utilizing surgery is also a lifelong journey. It's something that needs ongoing support from a multidisciplinary staff, similar to what we offer at the Weight Loss Institute, including dietitians, people who specialize in exercise, behavioral health specialists, nurses, and physicians. And this entire team approach is what will help patients be successful. And it's really, really important that you have that when you start investigating having weight loss surgery or having non-surgical options for weight loss as well.
Another viewer wants to know, they say, I've had a previous weight loss operation, but I'm gaining back the weight. What's the next step?
Well, I would say understand you're not alone. We know that 10 to 15% of patients will gain weight back after their weight loss procedure, even gain enough weight back that they're no longer what we would consider the procedure to be effective, and that is less than 20 to 30% of your excess weight, or as we talked about earlier, excess weight being less than 20 to 30 pounds out of 100 that you would have lost. Because of that, it is important to come back and visit with me. We can talk about what are the different options after your previous weight loss procedure. Depending on the procedure you had, there's not one option that is right for every person. And so we talk about the risk, we talk about the benefits, and we talk about which procedure would likely be most effective in revising or converting a procedure that you had before to a new procedure, or just revising that procedure itself.
A couple different questions asking about referrals. Does someone need a physician referral to come to the SSM Weight Loss Institute?
It really depends, and it depends on your individual insurance. It depends on what the process is from your insurance standpoint. That being said, we love referrals from primary care doctors and from other physicians because we love to partner with those people that will continue to take care of you in addition to us at the Weight Loss Institute for the rest of your life. And so whether or not it's required, if you will talk with your primary care doctor and visit with them, I always think that's valuable. And we rely heavily on the other physicians in both getting you ready for surgery, but then also continuing to treat you and your other medical conditions after weight loss surgery.
So it's really a team effort.
Absolutely, Kate, absolutely.
A viewer emailed us asking, are the physician and surgical costs covered by Medicare?
That's a loaded question because, again, Medicare depends on all of the different potential parts that a patient may have. In general, what I would recommend is to go online to the Weight Loss Institute at SSM, come by the office, call in, and we can send you a packet and then verify what benefits you have. Much of Medicare does have benefits for weight loss surgery, but again, it ends up being kind of an individual coverage based on what your policy is.
A viewer emailed in asking, what method is best if you're worried about excess skin after a weight loss surgery?
When you look at weight loss procedures and you look at excess skin, we know that the amount of excess skin that you have after a weight loss procedure depends on many things. It depends on your age, because we know that as you get older, the collagen that provides the structure of the skin decreases and is not as healthy. It depends on how much weight you lose. If you don't lose as much weight, you'll understandably have less skin. It also depends on how active and how much muscle building activities you do after surgery, because those things will all help tighten up skin.
That makes sense. Lisa wants to know, how many times can you have weight loss surgery redone?
I would hate to have that question, only because it means that there have been procedures that have been done in the past that have not been effective. And we know that we've gone through, in this country as well as around the world, a series of, I don't want to say experiments, but of weight loss procedures that have not worked well. It really depends. It depends on the individual patient. It depends on what procedure you've had, but it's definitely something that we can sit down and talk about in depth.
Another question coming in, what kind of psychological requirements are there for having weight loss surgery? If someone's taking antidepressants, does that exclude them from being eligible for weight loss surgery?
Yeah, I wouldn't say that definitely doesn't exclude patients. There are different criteria that we have in assessing patients, and all of our patients visit with our behavioral health specialist as they sit down and talk about not only their expectations, but how well of a fit weight loss surgery may be. The biggest psychological or the biggest important psychological factor in having weight loss surgery is that you as a patient have your mind set in a position that you say, this is what I want to do. It's not something that you feel pressure to do, that you feel out of desperation, but it's something that you know is right for you, and that's how we know that you're going to be the most successful.
Another question coming in saying, I was a gastric bypass patient in 2002. Prior to my weight loss surgery, she was an emotional eater. Consequently, she's regained about 2/3 of the weight she lost. She's not happy about that and wants to know what alternatives you recommend for someone in a situation like hers.
Yeah. Emotional eating, boredom eating, snacking, stress eating, they're all reasons that cause patients, whether or not they have had a previous weight loss procedure or not, to struggle with obesity. There are things that we can do to intervene with that, to help you meet with our behavioral health counselor, that you visit with myself, and we can address those and help identify those things. And potentially there are surgical options as well. Without doing some additional testing to understand your anatomy, to understand the exact procedure that you had done, it's hard to say what procedure we would do, what would the option be, but we do know that there are options, and we offer a multidisciplinary approach to help all patients who have had weight loss surgery, whether or not you had your procedure done at the SSM Weight Loss Institute. We're happy to have you come in and see us and to help you through that next process.
A couple people asking about a little more information about pharmaceutical options. Can you tell us a little bit about that?
Yeah, the pharmaceutical options, we have to look at both prescription medications and non-prescription medications. There are a lot of non-prescription medications that are utilized for weight loss. Unfortunately, many of them do not offer long-term benefits. There are three currently main medications, two which I prescribe for weight loss, one that has just come out within the last couple of months. But the two that I commonly use are called Belviq and Fusemia. And these are two medications that I feel have a reasonable amount of risk with the results that they offer. Around 5 to 15% of weight loss with those two medications. And it's definitely something that we visit if you're interested in non-surgical therapy, or even if you've had surgery. We can also offer potential or the use of those medications to complement your surgery. Say if you've gained weight back or you want to lose a little bit more weight.
Amy from Creve Coeur wants to know, how does the meal replacement program work and what makes it safe to consume such a small amount of calories?
Yeah, hi Amy, that's a good question, and it's meal replacements are something I believe strongly in, and the reason I believe strongly in is because there are a lot of nutrient-rich meal replacements out there that allow for caloric restriction. And because they're low in calories, you can, and high in protein often, and we know that protein is very important to controlling hunger, that by consuming those in a frequent enough amount, at the end of the day, you consume far fewer calories. I make sure that what I recommend, the HMR program that we offer here, is one that provides the nutrients you need, occasionally plus the addition of a vitamin, to make sure that you don't become unhealthy as you lose weight. But ultimately, even with the very caloric-restricted diets, caloric-restricted meal plans, it's still possible to get in the nutrients that you need to be healthy and then to obtain significant weight loss.
Now, are there any restrictions for people who want to do the meal replacement program? For example, if someone were to have diabetes or high blood pressure?
So that's kind of loaded, and that depends on the level of caloric restriction that you do. The more caloric restricted that you do, the more important it is that it's medically supervised, especially in a person who has diabetes or is on significant other medications that may be impacted by weight loss. We know that as patients lose weight, even as little as 10 to 15% of their weight, so in a person who's 200 pounds, even weight loss of 20 to 25 pounds will lead to significant improvements in their diabetes and high blood pressure. Of course, if we improve your diabetes and your high blood pressure with these meal replacements, that may mean that you become over-treated with the medications that you're on. And so therefore it becomes very important that you work with a medical professional in order to make sure that you don't become over-treated and develop things such as low blood sugar or low blood pressure.
Josh emailed in wanting to know how much can a person expect to lose on the meal replacement program and about how long would it take?
Yeah, good question, Josh. We know that the meal replacement program is going to be a slower weight loss process than, say, something that's more invasive, such as surgery. There's decent data that shows that the weight loss can be anywhere from 5 to 10 to even as high as 15% of a person's weight can be lost with the meal replacement program. Of course, the amount of weight you lose will depend on how well you stay on the program. The studies that look at weight loss do show that patients that have finished the program, if you don't finish the program, if you don't continue on the program, you'll likely lose less weight. The weight loss, starts immediately as soon as you start cutting calories, and usually can be sustainable even up to several years being on the program.
We do want to say thanks to all the questions coming in, and a reminder, if you do want to get your questions answered tonight by Dr. Wheeler, you can email in your question, askssm@ssmhc.com. Also, you can tweet us, just use the hashtag AskSSM, or post a question to our Facebook page. Another question coming in, how does a person transition off that program, one of those meal replacement programs you were talking about, and still maintain that healthy weight?
Yeah, lifelong intervention. That's a good question. That initial weight loss becomes maintainable when you transition into healthy eating, and that's one of the key components that we work on at the Weight Loss Institute, is to move from a pure meal replacement program to more of healthy eating. Now, I'm a big proponent of continuing to use meal replacement for life. For anyone who struggles with their weight, meal replacements of varying types that are out there, that are found in different supermarkets and nutrition stores are important because it provides such a significant amount of caloric restriction. And so I encourage those. I recommend utilizing those. But as you move from a pure meal replacement program to one of healthy eating, at the Weight Loss Institute, we provide guidance in that process.
A lot of people asking if they are interested in surgery. They have that initial consultation with you. How long does the process take before they actually have the weight loss surgery?
I would love to be able to tell every person this is the amount of time that's required. Unfortunately, a lot of it comes down to the individual insurance policy. Sometimes it can be as soon as 4 to 6 weeks from the initial consultation, and sometimes it can be as long as 6 months or more, depending on what the insurance policy is. The best way to know how long that will be is to go ahead and turn in one of our packets or applications that talks about your medical history. It allows us to verify your insurance benefits, and then one of our insurance specialists and professionals will get a hold of you and talk to you about what your individual requirements would be for your insurance company. Unfortunately, it's just so diverse based on so many insurance companies that are out there.
Another question, before and after surgery, will I be required to go on a liquid protein diet?
Yeah, that's a good question. Liquid diets are important for weight loss surgery because it does a couple things. Number one is it helps shrink the size of the liver. Number two, it helps decrease the overall amount of fat within the abdominal cavity. And both of these things make for a safer procedure. In terms of if you do or how long it will be, depends on what your overall weight is. That's something that we'll talk about when we come to you in the office. After surgery, all the patients are on a week of a liquid diet. That allows the swelling to go down, decreases the rates of nausea and vomiting and things getting stuck. And the other benefit that it really has is it gives patients a great jump start to their weight loss. Some patients will come in after their liquid diet having lost 15, 20 pounds or more prior to even having their weight loss procedure, and it's a great start for patients beginning this weight loss journey.
Absolutely. Well, that was our last question. Dr. Wheeler, is there anything else that you'd like to let people know about this evening before we head out?
You know, I just want everyone out there who's struggling with obesity and who's watching this to understand that there's no reason for despair. There's no reason to give up. There's no reason to become down on yourself, to say, I'm lazy, I don't care, that there's no hope for me. Because there is. We have multiple good options to help you lose weight. We have options that will help you regain control of your life, regain control of your health, and give you a new perspective on life. And so I would welcome and encourage you to come in and see me so that we can talk about how we can give you the next jump start on the next phase of your life.
All right, well, thank you very much. And thank you to everyone who sent in your questions. Of course, thank you to Dr. Wheeler for taking the time to talk about a subject that really affects so many people and so many different people. If you're looking for more information on our weight loss programs, visit our website, ssmhealth.com. That's also where we'll post a link to this video so you can also see that and share that with your friends. Thanks so much for tuning in. Have a great night.